Time now for Ask the Expert. Today we are talking about women's health.
And joining us live this afternoon is Dr. Tracy Capes. She is a urogynecologist with the Aurora Healthcare, and we're talking about urinary incontinence. Most people don't even know what urinary incontinence is.
It's true. So urinary incontinence is the involuntary leakage of urine when women don't want to. And that can happen either when they cough or sneeze, or also with that urge, like I gotta go, and then sometimes it comes out.
How big of an issue is this?
It's huge, and it's unfortunately one of those things that women don't speak about, but it can affect up to 40 to 50% of women at some point in their lifetime.
What are some of the ways you can possibly deal with this issue?
So the main risk factors is a genetic risk factor, but then there's also pregnancy, as well as obesity, some of the things in our diet, exercise, constipation. So kind of taking care of your overall health can really improve it somewhat as well.
Is there anything that you can do, early on, when you're younger, before you're pregnant and you have children?
There are. So pelvic floor exercises or Kegel exercises are the perfect way to start preventing incontinence, both the stress incontinence and the urge. And there's a variety of pelvic floor therapists throughout the Milwaukee area that women can go see even before it's an issue or when it's just starting.
And is there any way to, if you have urinary incontinence, is there any way to possibly get rid of it? I mean, other than doing the exercises to ultimately get rid of it, or will you always have these symptoms or this
Some of them,
disease?
it can be a chronic condition, but there are medications, there are new therapies like Botox or nerve stimulation for the urge incontinence issues. And then ultimately for things like stress incontinence, there are certain surgeries that can help women deal with it.
Women do joke, after pregnancy, like, oh, if you sneeze or you laugh too hard. But also, is this something that women should be talking to their doctors about, or doctors should be bringing up with women?
Both. Women should be talking about it with their physicians very early, and doctors should be asking their patients at all their annual visits if this is an issue, because there are a lot of interventions that don't have to be medical or surgical that can help.
If it is genetic, is there a way to tell that in advance, or
just
do you just find out?
Or just talking to your parents?
Talking to your mom, your
Right.
sisters, your cousins, things like that. And unfortunately, women, we don't do a good job of speaking about it with one another, and people find out later rather than sooner.
Right, when it happens.
And I'm
Right.
sure
Right.
most people, like you said, don't really talk about this, but are we talking about just a little spill, or it could be a big spill?
There's a whole spectrum. So, there's some women that have it, once or twice a month, and there's other women where it affects them daily, and it prevents them from going about kind of their normal activities. And that's when it really is a problem, and hopefully we don't let that get that far for them.
Right.
Well, if you have a question for our expert, you can always email them at asktheexpert@tmj4.com, or you can leave a message on our line at 414-967-5253.